rolling.
So Todd, can you please tell us why you decided to use the Screening Link to Care program in your schools?
Yes. We are an MTSS school, multi-tiered systems of support. And one of the things that we lacked on the mental health side of things was any kind of an assessment that could tell us where our students were at. If we think of what we do with mathematics, for example, we have an assessment that tells us how kids are doing in math, and then we can go and get them the assistance that they need if they're not doing so well in math. In mental health, we didn't have something like that until we started working with you folks. And really, I know that it's something that all my colleagues around the state were looking for. How do we have that measure of a child's mental health, particularly suicidality, anxiety, depression? And so now we have an assessment system that allows us to determine which kids need some extra help. And it's really as simple as that.
And what kind of benefits have you seen? Because you've been implementing this for several years now. And are you seeing impact among your students or your staff due to the program?
Absolutely. I mean, I would venture to guess that we've saved some lives. I hope that's been the case. We've had students who were heretofore unknown to have been suicidal who, lo and behold, had maybe attempted and been interrupted in the attempt of suicide. And so in those cases, at the very least, we've been able to connect those kids with some care and help their family be aware that that was an issue for them. The best case scenario is that we're actually intervening at the right time so that, we're having more students not make that choice of suicide. And I think that long term, I think we're also seeing a reduction in depression and anxiety in our students. One of the epiphanies for us and surprises, this sort of discrepant event for us, was that suicidality would be as high as it is among the sixth graders. We really thought that we would see higher suicidality rates among the seniors in school, and that would be something that would climb through the grade ranges. Not the case. For us, the highest suicidality rate is among sixth, then it tends to drop off after that, which tells us a couple things. One, that students are arriving to suicidal thinking at an early age, and then two, that maybe the suicide prevention programs that we have in place are being effective at reducing suicidality throughout the years.
And if there is something you would like to share with other schools who haven't yet implemented Screening Link to Care, what would it be?
I would really urge all schools that go down this path to work closely with their community. In our case, in Livingston, it happened to work out really well that we had our nurses conduct the program. And so they're the ones who do the proctoring of the assessment. They're the ones who know if there's a positive. They're the ones contacting the families. But that might not be what works best in another community. It may be their counselors. It might be their administrators who the community has trust in. So that I think would be the gold nugget advice for other school districts, would just be develop this program in partnership with your community versus developing and trying to sell it to your community.